viewers. Today the topic of our discussion is dermatology, and we have the wonderful Dr. Sadaf Emal Asim for this. Hi, how are you?
I'm fine.
Welcome to the show, first of all.
Thank you for having me
Thank
here.
you so much for being here. Okay. So, because the viewers, some of them might be unfamiliar with you, most of them would know you, of course. So, can you just start elaborating your journey to dermatology, why dermatology, and what you do generally?
Okay, I'll start with how I chose dermatology, right? So, when my inspiration to become a dermatologist, was that when I was a medical student, there were a handful of good, properly qualified dermatologists. And at that time, we could actually count the number of fellows on our fingertips, and that too limited to one hand. So that I felt was a huge sparsity as far as the field was concerned. And the second one was that I felt that the proper justice to this field was not being done at that time. People usually assumed that it was I basically felt it was a very neglected field.
Okay.
And people thought, okay, if you're not doing anything, go in dermatology. Anyone who's doing nothing can practice dermatology. So that concept was disturbing for me, because it's a very challenging field. It's not a simple field at all as the conception or the misconception lies. And it has so many different attributes to it. Taken as so many different tributaries, which make it even more interesting. And as like any other field, if you work hard and dedicated, then that is equally as what we call challenging as anything else. So both these, that is my aim and my inspiration, led to my achievements. And I am basically from Dow. I'm a gold medalist, and I have done my fellowship in dermatology. And then I've done my diploma in dermatology from Royal College. I have done my diploma and fellowship of aesthetics from American Academy of Aesthetic Medicine. I have done countless certified courses in aesthetics and different other CMEs and others. I am a supervisor for dermatology as well as pediatric dermatology. And I am the head of the department and chairperson of dermatology at Dow University of Health Sciences, Ojha. So this is just a brief outline. I have done innumerable researches published in national and international journals, and I'm also a reviewer for both of them.
Okay. So great as always. Thank you for that. So आज का हमारा topic specifically is on acne. Now, acne is a very prevalent issue. I think everybody जिंदगी में एक दफ़ा तो मतलब they have faced the issue of acne. अगर वो थोड़े से pimples हों, different types होती हैं and all of that, and that is why you are here, ताकि हमारी audience को थोड़ा इसके बारे में पता लगे. So let's start with for a commoner, if you have to just simply put कि acne है क्या, what is it?
Okay, acne, you're very much right. It's one of the commonest conditions. ठीक है ना? It's the 8th most prevalent disease in the world, and about 9 to 12% of the worldwide population experiences acne, and we are no different. We're part of the world. So every 5th person presenting to us in our outpatient has acne, any form of acne. ठीक है ना? Now, acne in very, very basic terms, we can just say is the common zit, bump, or a pimple on your skin. But it's not just one thing. Your blackheads, whiteheads count for acne. Your pustules that is the part of acne. You can have very extreme forms of acne. In the medical term, it is inflammation of your pilosebaceous unit. Okay? Your skin has oil producing glands on the body, which are usually quiet and dormant from birth till puberty. Once you reach puberty, adolescence, maturity, under the influence of various hormones, these glands become really active and they start producing oil on your skin, which is called sebum. Most of the people are aware of this term, sebum. So that is a good thing. It's not a bad thing. It's a natural moisturizer of your skin, okay? And when this becomes excessive because of any reason, either the hormones or the environmental factors or any other reason, which we can also discuss later, it leads to excessive oiliness of your skin. Now, this excessive oiliness can just remain excessive oiliness, or it can progress further on. When it's too oily, the normal migration of the cells in your hair follicle linings, which are connected to these glands, they become clogged or blocked. This blocking leads to what we call the blackheads or the whiteheads formation. Now, it can just remain limited to this level, or it can further progress. Another advancement is that there are certain bacteria which are normally present in your skin which are not harmless at all. But once the openings get blocked, these bacteria are blocked inside with them, right? And they are constantly multiplying and they have no place to escape. So that leads to inflammation or redness or red bumps or zits on your skin. Common terms may I keep getting, I have a zit, I have a bump, I have a pimple. So this is what's leading to that, okay? And then depending on the amount of inflammation produced from these and the release of different mediators and your own body response, you get different forms. Like it could be just a red bump, it could be a yellow bump, it could be more inflamed leading to cysts or nodules, and then so on and so forth. And then depending on how you deal with it, it leads to the different complications like scarring, pigmentation, which is the second chapter.
So we're clear on what acne is. What are the most common causes for it? Like kin wajuhat se, in fact, things like a common man would usually ignore, but they don't know and they keep on doing that. तो कौन सी ऐसी चीजें हैं that would trigger acne, maybe या acne है तो make it hard for it to go away?
Okay, first of all, we need to understand that acne can happen in anybody. Okay, it's not just limited to one age group or one gender. Okay, this is a huge misconception that acne is just limited to ladies or females. It can involve females, males, as well as little newborns as well. So this is one thing we need to clear. Then we have to go in what is causing. It could be a genetic factor that is usually pretty strong, and then it could be environmental factors. It could be because of certain drugs you've taken or you need to take because of any other reason, not just otherwise. Or in my सबसे top of the line are the steroids, okay, the systemic as well as the topical steroids, and there are others as well, but these are the top of the lines. Because हमारे यहाँ we have seen a really bad practice that patients just go to a relative or a pharmacy and they just ask them, okay, give us something, and the first thing they are prescribed are different forms of steroid, and that just makes it worse. That's why I'm especially mentioning steroids. Then it could be because of certain occupational exposure, especially people who work in the oil industries or hydrocarbons and all these, they are more prone to developing acne. Thirdly, there are certain internal conditions such as you could be a patient of PCOS, polycystic ovarian syndrome, that can usually present with
which
acne.
Is very common.
Which is very common,
girls.
exactly. Acne is one of the presentation. You can have increased hair growth, which is hirsutism. There could be increased weight gain. There could be menstrual irregularities, infertility. You don't need to have everything present at the same time. It could be just one thing, but acne is one of the identifying features. And usually if it's PCOS, people who have acne usually have it on the lower jaw area. That is more significant.
Yeah, chin pe aksar and
Mostly,
jawline.
the jawline is most commonly involved. Okay, and then again there are other features such as, for example, general features such as diet. Now diet is a controversial thing. Some people feel that diet has nothing to do with it, but studies have shown that diets which are rich in glycemic index, that is very sugary foods, they can aggravate or perpetuate your acne.
Even natural sugar, just
any form of high sugary foods.
Okay.
So you would have heard some people complaining that I get pop-ups when I consume chocolates or any such similar stuff. That's basically because these are sugar-rich stuff. But otherwise also, not necessarily कि सिर्फ sugar ही हो, it could be other things also. So this is more subjective. If a patient tells us कि I feel an aggravation when I consume this particular type of food, we just tell them to avoid it for some time. Like cold drinks, that's also very rich in sugar content. Similarly, it could be any other thing. So it's mostly subjective, but the established norm is for the high sugary content foods. And then people who excessively oil their scalp a lot, that is something also that we need to keep in mind, because already you have a very oily skin, and there's a very natural tendency that people oil their scalp and they leave the oil for 2-3 days. That's a normal practice.
You're not supposed to do that.
Not at all. So when you already have such an oily what you call base, and which is actually one of the etiological factors of acne, and then you oil, and oil ऐसा भी नहीं होता कि वो हल्का सा है, वो तो बहने वाला होता है
बहुत ज़्यादा,
and that's what people think is the normal practice. That will further worsen.
But ये सारी अम्मी दादियों से हमने सुना है ना कि like रात भर छोड़ोगे सर में तेल लगा के, so it's actually good for hair and it will absorb, and I don't know. So
scientifically, there's no
dermatologist rejected it.
Yeah, you can do that if you don't have any acne and you want to do it overnight. Your choice. But if you are a patient who has active acne, it's a big no-no.
Okay.
Okay.
So moving on, what are the treatments available, and what, I mean, obviously patient specific hota hai, individual specific hota hai, but what are the most common and effective treatments available that the patients can seek out?
Okay, now when we treat acne, as you said, we have to deal each patient individually, right? But first we have to assess what type of acne they have, okay? The most common form is acne vulgaris, which is mostly seen, vulgaris means acne, so that's the most common form. And then we have to decide whether it's mild acne, moderate or severe. Accordingly, our treatment changes. Again, we have to see whether they have taken any treatment before. If it's a female, if the patient is trying to conceive, if she's in the fertility period, we have to keep those considerations in mind. If the patient has an underlying PCOS, has she taken treatment for that, and so on and so forth. Okay? So if we can identify an aggravating factor, that we have to push aside. Like any other treatment, counseling is most important. We have to counsel the patient. Then as far as the treatment is concerned, one is general measures, we'll talk about that later. But as far as the specific treatment is concerned, we have topical applications, we have systemic therapy. Now, when we have topical, topical means the ones that we apply on the skin, right? We have a wide range. We have a range from topical antibiotics to topical retinoids to other non-inflammatory agents like niacinamide and others, azelaic acid. So accordingly, what the patient is presenting, and keeping all these factors in mind, we decide. If it's non-inflamed acne, that is comedonal acne, blackheads, whiteheads simply, or very few small bumps, then we prefer just topical applications. However, if the patient is not responding, or if it's very extensive, या बहुत ज़्यादा redness है, बहुत ज़्यादा yellow दाने हो रहे हैं, all this stuff, then we have to add some form of systemic therapy. And उसमें initially हम antibiotics देते हैं to bring the inflammation down, and then we follow the patient, we see the patient. Now again, we had the fertility, I keep mentioning this again because one of the best treatments for acne, for those people who have extensive acne, severe acne, not responding to other forms, is retinoids. But वो ऐसे ही नहीं शुरू करते थे. So we have to take a proper history, explain everything to the patient, and then proceed on. The one thing I want to mention here is that acne is a treatable condition. When about 20 years ago, it was a condition जिसको लोग कहते थे कि it's not treatable, you can just control it, इसका कोई इलाज नहीं है. But yes, acne का इलाज है. It's a very well treatable condition. As soon as you get acne, come to us. We will treat you. The earlier you come, the better the response to treatment. You get treated, it boosts your quality of life because of because of the treatment and the results. And we can also treat the complications, that is the scarring, the pigmentation, everything with acne and its related sequel is treatable. So there's no this concept, it's a non-treatable condition. It's a very, very well treatable condition with very, very good results.
Okay, so beach mein you spoke about self-esteem issues and counseling the patient. So although I do know this would fall rather on the side of psychologists, but as dermatologists, what measures do you maintain जिससे you could ensure that patient की mental health या well-being जो है साथ में, because I mean acne can cause severe self-esteem issues as well in individuals, especially young girls, young boys, तो उनको बहुत ज़्यादा ये complexity या insecurity हो जाती है. So as dermatologists, do you guys ensure, or is there a measure that you at least try कि उनको इस तरीके की counseling भी provide की जाए जिससे उनका self-esteem या mental health and well-being पे focus किया जाए?
Yes, because this is the quality of life impact is not just limited to acne. It is related to almost every disease that involves the skin, because skin is the largest organ. It's the exterior of you, and I'm sure anyone and everyone is very much concerned with how they appear, right? So even if it's anything that's sort of disfiguring you or causing your appearance to become shadowed, you consciously or subconsciously are concerned. It's not easy to say, stop
Easily
thinking about it.
avoidable,
Yeah,
I mean.
it's you can say that, but I know it's not practically possible. So on how every person reacts is different. Some people are over concerned and some people are less bothered compared to the others, but otherwise it affects everybody. So when a patient comes to us, we always give them an encouraging note that don't worry, no matter how severe the acne or how mild it is, we always give them a positive note that it is a treatable condition. We will make it go away. You just have to be regular with your follow-ups and come and meet us. And if you have study your disease, we always give them a diagnosis and we tell them to study the disease. We ask them to study the medications we're prescribing them. If there is a question, you can ask us. We have no problem answering your queries. And once we treat your acne, we will treat whatever the sequel follows. And alhamdulillah, every patient benefits. We have conducted 2 studies on this as well, and before treatment and after treatment as well, the impact on quality of life for patients with acne. So we are concerned, and we have definitive parameters for judging this thing, and we follow those parameters. So I think just counseling the patient, and you don't have to give lengthy sessions, but just giving them a little hope goes a long way. However, if a patient has very severe form of acne, then sometimes I do feel the need to refer them to a psychiatrist or a psychologist for a different manipulative event, because we have a variant of acne as well, which is called acne excuri, in which the patient has this urge to just pick on this. Then sometimes they agree to it, sometimes they know it, but they are in a state of denial. But they tell us that unless I squeeze it out, I just can't relax. And they know it's bad, but they just can't help it. So if we can just calm them down, yes. If we feel this is beyond us, they need proper help, we do refer them. Similarly, sometimes the patients are so depressed or they are so anxious about themselves that I do feel they need some extra help. So because we are a tertiary hospital, we are in liaison with all the departments, so it's not difficult for us.
Okay, so aajkal Sadaf, there has been a term which is very common, adult acne. So adult acne and acne in maybe a 16-year-old में फ़र्क क्या है? And if there's an individual जिसको lifelong acne नहीं हुई, I mean, teenage is the prime years, right, for acne to develop with the hormones going over the place. But if somebody did not develop acne throughout their life, and then they they are 30 or they're 25 plus and they develop acne, so I mean, correct me if I'm wrong, but that is adult acne. And what's the difference between the causes for these two?
One thing, acne can happen anytime between 14 and 40.
Okay.
Okay? It's a disease of the adolescence, meaning it's most common in teen years.
Okay.
But it can happen anytime. It's not necessary that if you have acne from 12 years, you can progress to 50 years. And it's not necessary that if you didn't have acne till 30, you won't have it ever. And 3% of adults present with acne after 35 years of age who have never had acne before. This is data, scientific data. So acne can happen in anybody. Similarly, in males, it usually tends to wear out around late 20s or 30. Usually males do not experience acne after 30 years of age, but in females, anytime. It could be a lot of reasons, and it could be just because it's there. Because I said nothing to worry. Your makeup, because women spend a lot of time in the kitchen cooking, and they're really not very careful about their skin. I'm really happy that people now are so aware, they have a proper skin regime. But majority a couple of years ago didn't even bother till it was too late, right? So since they don't take care of themselves, things happen. Then there's certain women who are on oral contraceptives for reasons, so they can have acne. Stress is one of the aggravating factors, and it just makes it worse, obviously. And then people, one more thing, people who use too many products on their skin can also have a flare of acne, right?
Okay.
So it depends. Sometimes you can have some other disorder going on inside you, because of which you're taking certain medications which can cause acne. So the different factors. But acne can happen in anybody. It is not something rare.
Age specific.
Exactly.
It's not
Similarly,
age specific.
acne can involve your body as well. It's
Okay.
not just a disease limited to your face.
I think the most common areas अगर body पे जाते हैं तो I think neck, back,
Back and
shoulders,
chest, yeah, exactly. Any area which is rich in your sebaceous glands can have acne. But there's a misconception that acne only involves the face. How can it involve the body? It can. Sometimes your face is not involved, only your body is involved.
Yeah.
So it can happen both ways, right? And similarly, another misconception is that it is just a disease of the females. How can it happen in males? It can happen in both. It can happen in either genders. It's okay.
Okay, so Sadaf, you mentioned skincare routines. Now, uspe these
acne?
days, no, not just for acne. वैसे भी these days, skincare routines are very much in. They're very hot these days. Everybody has like a 10-step, 12-step Korean skin, glass skin. पता नहीं क्या क्या हो रहा है. And you have a lot of influencers, a lot of social media or celebrities, showing their 12-step skincare routines. Just में a lot of serum oils जो होते हैं, they are involved. A lot of जो I cannot say the name, but जैसे none side you said oils हैं, उसके all of that creams हैं. So what is a dermatologist certified and dermatologist approved, I would say that is a better word, the dermatologist approved skincare routine, if you have to give a little thing to the audience कि क्या करें and keep it like very जो सब लोग कर सकें and is a 12-step routine necessary?
Not at all. Now let me keep it very simple, okay? First of all, you are not required to use everything on your skin, okay? You should know what type of skin you have, and you have to be, it's not necessary it's an 8-step or a 12-step. You can just use 2 products, but the idea is to be consistent.
Okay.
Okay? Using a little amount consistently over the years is going to work way more than using anything aggressively for a short period of time. Secondly, do not be over aggressive with your skin. Being over aggressive irritates your skin. Thirdly, the oils you mentioned, if you have an acne prone skin, using any oil is going to deteriorate it.
Okay.
That is not meant. This is I get patients like these as well. They have this misconception that acne was happening because of loss of skin oils, so they keep applying oils and oils, and it's just,
and they dry it out.
It dried out. It made it so bad we have to do then procedures to correct that thing, right? So
what about serums, not oils?
Okay, serums may, for everybody in general, use a very mild exfoliant, very mild. You can just use it once a week. You don't have to use it every day. Use a good moisturizer according to your skin type, which is mandatory. The most top of the line is a sunblock according to your skin type. Okay? Again, because we're discussing mainly acne, when you have active acne, we don't recommend a very thick sunblock, chemical block. We prefer physical blocks like a broad hat or an umbrella, which is more suitable in our weather because we have really harsh sun over here, right? Thirdly, we did the sunblock part, right? Now for other in general, use a good vitamin C product, which is otherwise brilliant. It's an antioxidant. It works wonderfully for your skin as well. And then according to your skin type, find a good retinol serum. If it suits you, you have to start with a very less quantity, okay? And then you can build it up, and then you can go for whatever. Don't go to the most extreme version from day one. You'll just irritate your skin.
The retinol serums specifically acne ke liye ya people with the normal?
In general.
Okay, so it's good for skin.
Even acne it's good, but not in active acne. Okay, as I said before, we have to see the patient because as I mentioned, retinoids are the treatment for acne as well. So maintenance comes later. Okay? That this is something you're doing for general routine. Again, if you have very dry skin and you go for a retinol or a strong retinol, it might just make it worse. So you see, every product is not meant for everybody. This is what I gave you a basic highlight. But again, come to a proper person, they'll see your skin, and then they'll advise you accordingly, with which you can stick for the rest of your life.
Okay. So जैसे आपने अभी बात की कि it will increase first. So there is again building on to my next question which was about the common myths and misconceptions, because बहुत हैं right. ये भी है जैसे you said कि acne अगर बढ़ रही है so that is actually good because सही होने से पहले तो बढ़ेगी. इस तरीके के एंड सो मेनी देसी टोटकाज दैट पीपल यूज के टमाटर का पेस्ट या बेसन व्हाट आई कैन नॉट स्टॉप सेइंग राइट. सो व्हाट आर द मोस्ट कॉमन मिसकंसेप्शंस एंड मिथ्स दैट यू फील लाइक देयर इज अ नीड टू डिबंक दैट, लाइक स्टॉप डूइंग दैट राइट. तो कौन से सबसे ऐसे कॉमन है विच यू फाइंड अ लॉट in people and you want to make them stop कि ये चीज़ गलत है and this is a misconception?
Okay, some तो I just mentioned. Similarly, this concept के the scars produced by acne are never going to heal. Everything can be worked up. ठीक है? So just clear this thing. There's a huge misconcept that if you have acne, you don't need to seek treatment. It will go away in its own sweet time. No, come to us. We will treat you. Why should you suffer that pain and that ordeal of having acne and feeling bad about yourself? It will when you seek treatment on the right time, it boosts your self-esteem, it boosts your morale, and you feel much better about yourself, and then we can actually help prevent the complications that can follow acne. So thirdly, the concept that blackheads, the black color is because of dirt. It is not dirt.
Exactly.
It is not dirt at all. It's oxidized melanin.
So many people with acne, often hear that you just need to wash your face.
You wash your face, yes, but you don't over wash your face. There is a variant called detergent acne which happens because of excessive washing and cleansing and multiple over cleansing of your face. So don't do that. You just need to wash your face with a good mild product twice a day, and the rest you can just use water. That's all. And sun protection is mandatory, as I mentioned before as well. Another misconcept is that acne only involves females. It only involves your face, and the oils, it's because of the lacking of oils in your skin. Thirdly, another thing, that if you pop your acne, it's going to go away. Okay, that's the best treatment. Overnight treatment. Just keep popping them up. It's just going to make it worse, and then the pigmentation and everything.
Is there an overnight thing अगर एक pimple है किसी को?
There is no overnight thing.
I've often heard again with the myths वाली चीज़ ही that toothpaste लगा लेते हैं on that bump.
Don't.
So that is really, you should not do that.
Because toothpaste is just going to dry it out, na? It's not going to make it go away. It might be, after some time you'll feel a bump inside your skin, and that's going to start bothering you even more. इसी तरह some people say ice. When you start feeling कि कुछ हो रहा है, if you start icing it, it will just bring down the inflammation. It's not going to cure it overnight, but the inflammation goes down, so the cycle will get shorter. That is all. Better to have a product so that if you feel something is popping up, you can just apply the product to help it in as soon as possible. But there's no overnight cure. Okay, and don't go for overnight things. Anything that's really fast is not really very effective.
Okay, so acne पे हमने बहुत एक prevalent long discussion की है. What is there something else that is you as a dermatologist you think that people need to know about? Any tips, any advice from your end?
Okay.
What they can incorporate, in their daily lives easily.
Easily. Okay. First of all, you need to relax. ठीक है? Just relax. Don't overlook yourself in the mirror all the time and every time, in your cameras, taking pictures every angle, trying to see if it's becoming smaller, if the size is decreasing, or if there's another new pop-up. It will just make you more anxious. Okay? So you just need to relax. Stay away from the mirrors. If you have, whenever you visualize yourself, do it from a distance. Don't make a close-up view. This is very important, because the more you keep looking at yourself, every time you'll notice something new, and it's just going to
demotivate you.
Exactly. So you just need to calm down. Secondly, drink lots of water. That is the best thing. Cold drinks and juices and teas are liquids, yes, but they are not replacement to water. So drink lots of water. A healthy diet is good as everything. Again, as I mentioned, high sugary foods are usually said to be, it's not that you can't have them, decrease their what we call consumption. So you can have you can have your junk food once a week or something like that, but don't have it on daily basis or very, very frequently. That's a simple general advice. Otherwise also. Thirdly, if you have any other medical condition underlying, then you have to seek treatment for that. And don't wait for an overnight miracle happening. Come to your doctor as soon as possible. You don't have to go to the ordeal of misery. Just come. It's a treatable condition. When you have a treatable condition, get it treated. Thirdly, use mild products. Don't be harsh with your skin. You have to, even for washing your face, use your tips, okay? Do it very gently. Be very, very gentle with all of that. When you're going for home remedies, some of them are not harmless. So if you want to try them, okay, ask your doctor, try them. Some of them can actually make them worse.
खुद से नहीं करें.
खुद से ना
You need a
करें.
doctor's
ठीक है.
recommendation.
There are some people who say कि हमें aloe vera लगाने से अच्छा लगता है. Okay, if you apply aloe vera and you feel कि it's not worsening your acne, do it once a week. It's okay. But if there's certain people who use egg mask, it's gonna make it worse. So ask your doctor. That's what I'm saying. It's कहने को तो it's home stuff ना. So it's supposed to be harmless.
But even that can worsen it.
Yeah.
So
it depends from person to person as well, and thoda sa better safe than sorry. And sun protection. Sun protection to is mandatory. The sweat and the sun will make it worse. And I'm not saying you don't go out. You go out, but you go with your protective measure.
So we end the session today, and it was lovely having you. Thank you so much for all the great insights, and inshallah then we can collaborate once again.
Sure, inshallah. Thank you for having me here. Thank you.